There are so many things that could be happening all at once on one floor of a hospital. In some rooms, women are in labor for what could be countless hours. In others, brand new mothers hold her newborn baby. Crying babies can be heard from the nursery, and babies who have been in the world for a few days are fighting for their lives in the neonatal intensive care unit. This is a typical day in the new family center. The maternal nurses work tirelessly to keep things running as smoothly as possible and to make the process of welcoming a new baby into the world as easy as possible. After working in the nursery for 3 years, I gained knowledge and experience in the importance of maternal nursing. The information I give you will hopefully make you feel the same way. Maternal nursing includes antepartum, labor and delivery, postpartum, nursery, and NICU. The nurses who work in each of these maternal nursing all greatly impact the birth process. So what exactly is maternal nursing? The antepartum nurse plays a supportive and teaching role to the couple throughout the woman's pregnancy. She is responsible for making sure of the woman's comfort and that the couple is prepared for the birth of their child. Some of her duties include making sure that the couples know what to expect during labor and birth. They have been instructed on signs and symptoms of labor. They know what to do if membranes rupture before going into labor. They have discussed complications that may result in a cesarean section. They have selected a feeding method. They have purchased an infant car seat. They have found a pediatrician and have all of the items needed to prepare for the birth of their newborn baby. Preconception care promotes the health and well-being of a woman and her partner during pregnancy. Labor and delivery nurses assist the OB in the birthing process. First, the nurse must conduct the vaginal examination to assess the amount of cervical dilation until the cervix dilates to 10 centimeters. This examination also determines the fetal descent and presenting part of the fetus. This means that the nurse is checking to see how high or low the baby is from the birth canal and whether or not the fetus is in the correct position for a vaginal birth or if a C-section is going to be required. Labor and delivery nurses also check to see if the membranes have ruptured or if certain circumstances require the doctor to artificially rupture them. Another assessment that the nurse must perform is of the fetal heart rate and the mother's contractions. Throughout the birth, the nurse motivates the woman and encourages her to put all of her effort into pushing the baby into the outside world. She also provides comfort for the woman, notifying the doctor of the estimated delivery time and receiving the newborn and giving him or her immediate care. The newborn is immediately placed under a radiant warmer, dried off, assessed, wrapped in blankets, and placed on the mother's abdomen. Also, the nurse may assist the mother in breastfeeding her baby for the first time. The nurse maintains airway patency and thermoregulation and ensures proper identification of the newborn. Once the baby is in the nursery, the nurse performs the gestational assessment tool to ensure the baby's responsiveness. The baby is also weighed, measured, bathed, and given proper medication. Nurses are responsible for regularly taking the baby's vital signs. The postpartum nurse acts the emotional and physical caretaker of the new mom. The nurse performs an overall physical assessment and checks pulse, blood pressure, respirations, and pain. The postpartum nurse also promotes bonding and attachment between the newborn baby and mother, activity, rest, and exercise. Also, the nurse and new mother discuss breastfeeding if that is the method of feeding chosen. Finally, the nurse is a counselor for the new mom and prepares her for discharge and going home with her new family. Babies born prematurely or with birth defects go to the neonatal intensive care unit. 2 more common defects of birth include heart and respiratory complications. In the NICU, these babies are closely monitored and given one-on-one care. Over here, I have pictures. This is the antepartum. This is the doctor and the pregnant mother. This is the labor and delivery This is the nurse, the baby, and she's handing mom her new baby. This is in the nursery. They have their own little crib. And here is postpartum. This is the nurse filling the mom's fundus. That's the uterus after birth. And then this is in the NICU. This is an incubator that the premature baby's in. And that's mom and the nurse. I would like to conclude with these thoughts. Maternal nurses provide crucial care for the newborn baby and mother before, during, and after birth. Maternal nursing includes antepartum, labor and delivery, postpartum, nursery, and NICU. The nurses who work in each of these types of maternal nursing all greatly impact the birth process. Maternal nurses usually witness the wonderful experience of a woman becoming a brand new mother, but they also see the horrors when birth goes wrong. Maternal nursing is a rewarding job because they assist in welcoming a new life into the world.